My name's Kevin Fernando. I'm a portfolio GP based near Edinburgh with a long-standing interest in all things diabetes, CKM, cardiovascular, kidney, metabolic, and medical education. I'm collaborating with the medicines management team on a series of training videos to educate and upskill clinicians on diabetes management with a focus on CKM to improve confidence when reviewing patients living with diabetes. So I know we've had an explosion of new medications to support our patients living with type 2 diabetes between the SGLT2 inhibitors and the incretin therapies, both the GLP-1 receptor agonists and also GLP-GIP receptor agonists such as tirzepatide. We've seen some of the biggest therapeutic advances for type 2 diabetes, certainly in my career to date. But we mustn't forget that the cornerstone of the management of type 2 diabetes and indeed all long-term conditions remains positive lifestyle choices. As I always like to remind my patients, the first step in healthcare is self-care. We must educate before we medicate. Positive lifestyle choices are pivotal to the successful management of type 2 diabetes to improve both quality of life but also quantity of life. So, what I wanted to talk through in this session is the five S's, the importance of 24-hour physical behaviors in people living with type 2 diabetes. Now, these five S's are drawn from the recently updated joint consensus from the ADA, the American Diabetes Association, and the EASD, the European Association for the Study of Diabetes. A fantastic document, very forward-thinking, well worth having a look at. But what I wanted to focus on in this session is their lovely infographic, which talks about the importance of 24-hour physical behaviors for people living with type 2 diabetes, the so-called five S's: sitting, or breaking up prolonged sitting; sweating, moderate to vigorous activity; stepping, strengthening, and sleep. So I'm going to talk about each of these in turn and how focusing on these individual five S's can improve a range of cardiometabolic parameters, such as glucose and insulin levels, blood pressures, HbA1c, lipids, and also improve factors such as physical function, mood, depression, and overall quality of life. And one of the first key take-home messages from this joint consensus when talking about physical behaviors for people living with type 2 diabetes is that we see beneficial effects on that range of cardiometabolic factors and other factors I mentioned. We see beneficial effects across the continuum of human movement. Any movement is better than no movement. We must be smart when we set those goals for our patients living with type 2 diabetes. They need to be specific, they need to be measurable, they need to be achievable, and they need to be realistic goals as well. And we must reassure and remind our patients living with type 2 diabetes that any movement is better than no movement. So let's talk about these five S's, the importance of these 24-hour physical behaviors for people living with type 2 diabetes: sitting, sweating, stepping, strengthening, and sleep. So let's start with sitting, or specifically breaking up prolonged sitting. Now, many of us have desk-based jobs which involve prolonged sitting, and just simply breaking up prolonged sitting every 30 minutes, see, standing up, stretching for a couple of minutes, can have a significant impact on improving glucose metabolism. Whilst we're not quite there in the evidence base, that we are accumulating evidence that sitting is the new smoking. There's evidence suggesting that a prolonged sedentary lifestyle, prolonged sitting, can be as harmful to the cardiovascular system as smoking. As I said, we're not quite there in the evidence base yet, but it's a nice soundbite to reiterate to patients the importance of breaking up prolonged sitting. So let's look at this in a little bit more detail. This was a study published a few years ago now, looking at the frequency of interruptions to sitting time and the subsequent benefits for postprandial metabolism in type 2 diabetes. So, what this study found, unsurprisingly, that it was sitting or sedentary behaviors were indeed associated with an adverse cardiometabolic risk profile. And if you don't already have type 2 diabetes, prolonged sitting increased your risk of developing type 2 diabetes. And studies have suggested also that those who regularly interrupt their sitting time have overall more favorable cardiometabolic risk profiles, better glucose and insulin levels, lower lipids, lower blood pressure, etc. So, what this study found was actually in people living with type 2 diabetes, interruptions of 6 minutes every 60 minutes or 3 minutes every 30 minutes with either light walking or simple resistance activities, some lunges, maybe using a stretch band, significantly reduced postprandial hyperglycemia and also insulin responses. So you can see breaking up prolonged sitting has a very significant impact on cardiometabolic profiles. So nice soundbite again for our patients living with type 2 diabetes, particularly those who have sedentary jobs, about the benefits on their glucose levels by breaking up prolonged sitting. Next, we'll talk about sweating. And by sweating, we're talking about moderate to vigorous activity, physical activity that leaves you sweaty or short of breath. I work east of Edinburgh, which is a golfer's mecca. I'm always telling my patients that golf is not exercise. Golf does get your step count up, which we're going to be talking about just shortly. But what the people need to do on top of their golf is more brisk exercise, again, that leaves them sweaty or short of breath. So what we need to do is encourage patients to aim for, I appreciate this is aspirational for some, at least 150 minutes per week of moderate intensity physical activity. So jogging, cycling, anything that uses the large muscle groups rhythmic in nature. Or if it's realistic, individuals can aim for at least 75 minutes a week of more vigorous intensity activity. Hit high intensity type exercise, brisk running, fast cycling, cycling uphill, etc., spread over 3 days per week, with ideally no more than 2 consecutive days of inactivity. And of course, alongside this aerobic exercise, individuals should ideally supplement this aerobic activity with 2 to 3 either resistance, flexibility, or core balance sessions, yoga, tai chi, etc. So I appreciate this is just not realistic for everyone, for our patients living with type 2 diabetes, for us as healthcare professionals. But what this consensus tells us, even as little as 30 minutes a week of moderate intensity physical activity, so just a brisk walk, improves metabolic profile. So just even 3 to 5 minutes of brisk walking a day has a positive impact on metabolic profile. So remember, benefits are seen across that continuum of human movement. Any movement is better than no movement. So again, when setting goals, set goals that are realistic to that person living with type 2 diabetes sat in front of you. And also, the consensus reminds us to be aware of frailty, of functional dependence or frailty, or indeed severe frailty. Sadly, with some of the pathophysiological changes we see in type 2 diabetes, which of course include obesity, we often see frailty at an earlier age. So we need to be more proactive about identifying frailty. And if we do identify frailty, we should manage appropriately, but we should also recommend individuals undertake simple functional exercises, okay? Because the benefits of these functional exercises, even if you are frail, are just as good in those who have normal functional status, if not better. But of course, we need to bespoke those exercises, those physical activity interventions. So next, I wanted to talk a little bit more about the impact of regular aerobic exercise on blood pressure. So this was a really interesting systematic review, meta-analysis that I found that looked at comparing exercise treatment to a range of antihypertensive medications. Large, well-conducted network meta-analysis looking at 391 randomized controlled trials which spanned a number of medications for blood pressure and also a range of exercise approaches, endurance exercise, resistance exercise, and a combination of both. And what they found was the systolic blood pressure lowering effect of regular aerobic exercise was similar to many of the commonly used antihypertensives we prescribe in everyday clinical practice, calcium channel blockers, ACE inhibitors, ARBs. So the lovely soundbite I took away from this network meta-analysis, regular exercise is as effective as a blood pressure tablet. A lovely message for our patients living with type 2 diabetes and indeed the general population about the merits of regular physical activity in reducing blood pressure and perhaps avoiding a pharmacological management of hypertension. This study in particular looked at exercise, physical activity in people living with type 2 diabetes and impact on glycemic levels. And again, a really nice message for our patients living with type 2 diabetes. Regular aerobic exercise training improved glycemic management in adults living with type 2 diabetes with less daily time in hyperglycemia and a 6 to 8 millimole reduction in HbA1c. So I know that might not seem too much at face value, but your typical gliptin, sitagliptin, for example, only on average drops HbA1c by about 8 millimoles per mole. So regular aerobic exercise potentially as efficacious as a gliptin in reducing glycemic levels in people living with type 2 diabetes. So again, a nice soundbite for our patients to motivate meaningful behavioral change and positive lifestyle choices. And of course, we mustn't forget about the other benefits of regular aerobic exercise, improvements in overall quality of life, cardiorespiratory fitness too. Next, let's talk about stepping. Now, we all know exercise lore tells us 10,000 steps a day we should all aim for. But did you know that 10,000 steps is not evidence-based? It was plucked out of the air by a Japanese PR company before the Tokyo Olympics who were trying to market a pedometer. So the Japanese number for 10,000 where looks like a little person walking. And that's where the 10,000 steps a day has stuck ever since. And we all know that's just not realistic for many of our patients. 10,000 steps, 5,000 steps, even 3,000 steps is just not realistic. So again, this is where we have to individualize goals for our patients in terms of step count, something that is realistic, achievable for that individual sat in front of us. But what I loved about this consensus was that this consensus tells us an increase of just 500 steps a day is associated with an up to 9% reduced risk of cardiovascular morbidity and all-cause mortality. So just increasing your step count by 500 steps a day, which is around 300 to 400 meters, has an impact both on quality of life and quantity of life. And furthermore, a 5 to 6 minute brisk intensity walk adds 4 years to your life expectancy. So, two fantastic sound bites again for our patients living with type 2 diabetes, and realistic sound bites that you don't need to set off and run a 5K, 10K, or marathon straight away. Even just increasing your step count by 500 steps has a significant impact on your longevity and quality of life. So what about the 10,000 steps? And I've mentioned already. Is there any validation of the 10,000 steps? And the answer is yes. I wrote a little article about this a number of years ago. It was an interesting cohort study that looked at whether 10,000 steps did indeed improve outcomes. And what this UK study found, a UK study, so very generalizable to the patients me and you see on a day-to-day basis, was unsurprisingly that the more steps we did on a daily basis and the more intense those steps are, we saw greater reductions in mortality, all-cause mortality, mortality from cancer, and mortality from cardiovascular disease. And we also saw a reduction in incidence of cardiovascular disease and cancer up to 10,000 steps. So indeed, whilst that 10,000 steps was plucked out of the air originally, there is evidence to suggest aiming for that 10,000 steps does improve quality and quantity of life. And they looked at step counts beyond 10,000 steps. We all have colleagues and friends and even patients who manage 15, 20,000 steps plus. Do individuals get further benefit? The answer is yes. Any increases in step count beyond 10,000 steps further reduced overall risk of death. But really, the messaging I loved from this study was there was no minimum step count for benefit. So, once again, that mantra, any movement is better than no movement, no minimum step count. So, even for our most sedentary of patients, even just increasing their step count to 500 steps has a significant impact on quality and quantity of life. Next, strengthening. So strengthening exercises, so this by this I mean resistance exercises. So any activity that uses your own body weight or works against a resistance. So using a resistance band, chair-based exercises, calf raises, lunges against a wall, etc. These are all resistance exercises. What this consensus tells us that regular resistance exercises also improves insulin sensitivity and glucose levels. We all know our liver, our pancreas, our heart are metabolically active organs, but we mustn't forget our musculature is also a metabolically active organ. So maintaining or perhaps even building muscle tone also results in improvements in cardiometabolic outcomes. So, what this consensus tells us is we should encourage individuals to do either home-based resistance exercises or perhaps, if it's realistic, join a class for Tai Chi or yoga that also encompasses elements of flexibility and core balance too. So, strengthening resistance exercise is also very important, a key 24-hour physical behavior we should be discussing with our patients living with type 2 diabetes. And then the final S, interestingly, is sleep. Now, this joint ADA and ESD consensus at the time was it was published was the first modern consensus or guideline to explicitly mention sleep as a potentially modifiable cardiometabolic risk factor. And this really did pique my interest. So, what this consensus tells us is that people living with type 2 diabetes should aim for consistent, uninterrupted sleep even on the weekends. So, I appreciate this is aspirational for many of our patients and indeed, again, us as healthcare professionals. But what it did was broke it down to a number of factors. So, first of all, they looked at quantity of sleep. And what the consensus interestingly tells us, too little sleep, less than 6 hours duration, or too much sleep, over 8 hours duration, negatively impacts HbA1c. So, we see a U-shaped curve. And the nadir of that curve, around about 6 to 7 hours sleep, appears to have the optimal impact on glucose levels, on minimizing your HbA1c. But also, this consensus mentions quality of sleep too. What the consensus tells us is that irregular, broken sleep results in poorer glycemic levels. Number of reasons for this. Those who don't get good quality sleep are likely to have insomnia or perhaps another undiagnosed sleep-related disorder, such as sleep apnea, very common in people living with type 2 diabetes, or restless leg syndrome, again, under-recognized, underdiagnosed in people living with type 2 diabetes. And then thirdly, the consensus asks us to consider the chronotype of that person living with type 2 diabetes. So your chronotype is your tendency to go to sleep at a certain time, okay? So your evening chronotypes, your night owls who go to bed late and get up late, appear to have more adverse cardiometabolic profiles, poorer glycemic levels versus your morning chronotypes, your early birds, those who go to bed early and get up early. Now, I appreciate this is very habitual, very challenging to change your chronotype. But again, in those with significant adverse cardiometabolic profiles, this is something perhaps we might want to ask about. So, quantity of sleep, quality of sleep, and also chronotype. So let's look at sleep in a bit more detail, in particular the impact on HbA1c. So as I've told you already, what we see is a U-shaped relationship between sleep duration and HbA1c levels. Too little sleep, less than 6 hours, increases glucose levels in HbA1c, and too much sleep, over 8 hours, 7 to 8 hours, also increases glucose levels and HbA1c. So that sweet spot appears to be around about 7 to 8 hours to minimize glucose levels and HbA1c. So, what impact does sufficient sleep, both quality and quantity, have on HbA1c? Well, this was a really interesting systematic review and meta-analysis that I came across that looked at the impact of sleep amount and sleep quality on glycemic control in people living with type 2 diabetes. And what they found was individuals living with type 2 diabetes who got enough sleep and also good quality sleep can reduce their HbA1c by up to 0.35%. Now, again, I know this might not seem like much to at face value, but if you extrapolate this from the seminal UK PDS data, the UK Prospective Diabetes Study, the study that we base much of our modern diabetes care on, a 0.35 improvement in HbA1c translates to a 3% reduction in death from diabetes, a 2% reduction in myocardial infarction, and a 5% reduction in microvascular complications of type 2 diabetes. So, a significant cardiometabolic benefit, significant benefits for quality and quantity of life. So that's why this consensus, and to be honest, since that consensus was published, we've had a considerable literature talking about sleep and cardiometabolic health. So that's why these days we recognize sleep health as an important modifiable risk factor for improving glycemic control in people living with type 2 diabetes. So the consensus, that lovely infographic with the 5S's I showed you, also has a nice table that looks specifically at the impact of these 5S's, sitting, stepping, sweating, strengthening, and sleep, on a range of cardiometabolic and other parameters: glucose and insulin levels, blood pressure, HbA1c, lipids, physical function, depression, and quality of life. And the color of arrows represents the strength of evidence. Green arrows, strong evidence. Yellow arrows, medium strength evidence. And red arrows, limited evidence. Okay, so you can see for the 5S's, green arrows, high quality evidence that trying to focus on these 5S's, these 24-hour physical behaviors, significantly reduces glucose and insulin levels. High quality evidence. Also, good, albeit mixed evidence that focusing on the 5S's reduces blood pressure. Lots of good quality evidence focusing on the 5S's reduces HbA1c. More mixed evidence on lipids. And again, mixed evidence on physical function and depression and quality of life. But overall, the direction of travel is benefits, both in cardiometabolic parameters, but also quality of life and physical function too. So, well worth having a look at this in your own time. The first step in healthcare is self-care. Of course, in our limited consultation time spans, 10 minutes, 20 minutes, even 30 minutes, it's going to be challenging to cover all of these 5S's. So maybe pick one or two that are most relevant to that person sat in front of you. Talk about the merits. Oh, breaking up prolonged sitting, increasing moderate to vigorous physical activity, increasing step count, introducing some resistance exercises on a day-to-day basis, or talk about sleep hygiene and improving sleep health. Because focusing on these 5S's, 24-hour physical behaviors, alongside some of the great therapeutic advances we've seen for people living with type 2 diabetes, can significantly improve cardiometabolic outcomes. So I know some of you might laugh, but I have a small YouTube channel with a range of patient-facing videos focusing on people living with type 2 diabetes. I talk about the SGLT2 inhibitors, their benefits, their mode of action, side effects, sick day guidance. I talk about the importance of urinary ACR checking for people living with type 2 diabetes. I did that video in conjunction with Kidney Research UK. But I've also done a series of videos on each of the 5 S's, brief 3-minute videos or shorter that focus on each of the 5 S's and some of those lovely sound bites that I've taken you through already. So do have a look at my YouTube channel if you have some time. Feel free to share with your patients or your colleagues if you find them helpful. So thank you for listening, everyone. I hope you found that session helpful. Happy for you to get in touch with me if you have any questions or comments or any feedback. My contact details are here. I'm also active on social media, X, YouTube as mentioned, and also LinkedIn. I hope you find this series of videos helpful, and thank you for joining me.